Can drinking more water really improve your prostate and urinary symptoms? In this video, I'll be answering your burning questions. Hi, I'm Dr. Austin Slade. I'm a board certified and fellowship trained urologist here at Capital Surgical Associates in Boise, Idaho. A lot of people ask, how much water should I be drinking every day? And in what way might that be helping your prostate, your bladder, or your urinary symptoms? So to answer that first question, how much water should you be drinking in a day? There's really no set number. There's not a lot of evidence to back up that this is going to be helping your body in any meaningful way. It's certainly going to create a lot of trips to the bathroom with probably little added benefit. But there certainly is a lower level that you should be striving to reach, and that would be at least or around 2 liters a day. Reason for that can be severalfold. First, kidney stones. Now, hopefully you've never had to experience one of these before, but the more concentrated your urine is, the higher risk you are at developing stones in your kidneys, and that can cause a whole host of problems. Other reasons for why it might be helpful to stay well hydrated would be to keep the urine dilute. Now, certain concentrations, depending on what you're consuming in your diet, can be irritating or stimulating to your bladder. So having high concentrated urine might give you the sensation of needing to urinate, even though there's really not a lot of urine in there. That can be bothersome to a lot of folks, and they might attribute that to the prostate, but really this is a bladder irritation that's happening. What are some of those things? Caffeine, alcohol, spicy foods, peppers. Really, for each person, it can be different from one to another which of these foods is triggering the bladder or triggering these urinary symptoms. So if you really enjoy some of these things, it might be helpful to drink extra water to make sure the urine's a little more dilute so it's not as irritating to your bladder. Another reason drinking more water might be helpful is by changing the acidity of the urine. That's another thing that can be stimulating for some people's bladders. And drinking water will make it less acidic or closer to neutral, so it has less of an irritating effect on it. Again, the goal being here to just change the irritation that your bladder is experiencing. Having more urine in your bladder might change the perceived strength of your urinary stream. The more full the bladder is, up to a point, the stronger, the more forceful the stream. So it may seem that the bladder and the prostate are working better, but it's just a product of having more urine in the bladder. So the less irritating the urine is, the more your bladder is able to store and hold, then the more normal or natural your stream will feel. If you're going to the bathroom too early because the bladder is irritated by the concentration of what's in there, then that small volume of urination is going to be kind of weak, and you might feel like, gosh, something's holding up the stream here, when really there just wasn't enough in there in the first place to produce that normal urination. How might you know if your stream is normal? This is a really hard question to answer because you're only used to your own stream, and how does that compare to somebody else and what is normal? Well, there are some simple ways at getting at that. There are some neat tools that you can use on your phone, apps that allow us as urologists and you as a patient to analyze your stream and see where that compares to normal. These aren't widely available to the public. You'd need to reach out to your urologist, such as myself, to have access to one of these tools. You can gain tremendous insight into the functionality of your bladder, how much you're urinating, what the strength of that stream is, and how that compares to normal. But what about the prostate itself? Does drinking more water help the health of your prostate? Does it prevent it from growing enlarged or causing you other problems such as prostate cancer? The answer to that, unfortunately, is we just don't know. It wouldn't hurt to stay well hydrated, but drinking an excess amount of fluid, a gallon of water, 2 gallons of water, that's not going to meaningfully shift your prostate health in any productive way and is probably just going to drive you or your partner crazy with all your trips to the bathroom or road stops on your road trips. If you'd like to find out for yourself how much should you be drinking, how your bladder is performing compared to normal, please feel free to reach out to my clinic, submit a form online, and we'll find a time to meet and go over these things.